Good Morning America continues live from Times Square with Robin, George, Lara, Amy, Ginger, and Michael.
Let's move on now to our anti-aging series. Turn Back Time, and this morning is all about dissolving double chins. According to the American Society for Dermatologic Surgery, nearly 70% of Americans have them. But now a new non-surgical treatment may be able to help you melt a double chin away. ABC's Mara Schiavocampo has more.
Really shocked.
The double chin, a universally dreaded and hard-to-fix sign of weight gain or aging. Many trying anything and everything to fight them, from bizarre neck exercises
Stick your bottom teeth over your top teeth.
Of America,
to products and
Neckline
machines.
Slimmer is the world's first resistance toning system.
Even turning to invasive surgeries.
Hi, you ready to go?
But could the solution to battling this bulge be as simple as getting a shot?
Kybella is the only product that can actually melt or dissolve fat underneath the chin.
It's called Kybella, a recently FDA-approved injection using deoxycholic acid, a naturally occurring substance in the body that helps digest the fat we eat to destroy fat cells.
We inject Kybella into the area right underneath the chin. The fat cells rupture, and then the body flushes those dead fat cells out of the body over the next couple of months.
Doctors say for best results, patients should get 2 to 4 treatments. But note, they can cost a pretty penny, with one shot ranging anywhere from $1,000 to $1,500. But for some, it's worth the cost.
It permanently kills fat cells.
Each treatment lasts about 10 minutes.
I'm gonna clean the area, then I'm gonna numb the area and then place a template on that's gonna help guide the injections, and it acts like a temporary tattoo. Couple quick pinches, and then you're gonna be done.
Amy Seiverd says she had tried everything to get rid of her double chin.
I felt that it made me look older.
She had 3 shots during a clinical trial in 2012, and now, 3 years later, she is still thrilled with the results.
I can't say enough about it. I'm so happy.
All right, back with us now, Dr. Whitney Bowe, and expensive but impressive in terms of the results. But that's not the only way the neck ages. Tell us what happens.
Right, so there are 3 main categories when it comes to aging of the neck. So first, you have people who primarily have that fullness, and they are great candidates for Kybella. But then you also have a subset of people who primarily just have loose or sagging skin, and they would benefit most from a skin tightening procedure. And then last but certainly not least, you got people who develop this banding effect up and down the neck. So it's really a combination of those 3 things that contribute to aging of the neck.
All right, so we heard about the Kybella for the neck, that we saw what happened there. Right. When you have that loose skin, what can you do? You said tighten it?
Right,
How?
There's ultrasound and radio frequency procedures that can actually tighten the skin. So it's actually very similar to the shrinky dinks that we used to play with as kids. When you apply heat to the different layers in the neck, you can actually contract and tighten that skin.
Do you have to keep it up? Is it something you have to keep doing?
It lasts about 1 to 2 years.
Oh, wow. Okay.
Yeah.
That's longer than I would have thought. And then what about those neck bands? What can you do?
Right, so take a look at this. So basically, we have these things called platysmal bands in our neck, and they're muscle fibers. They run from the bottom of the chin down to the collarbone. Now, as we mature, those muscle fibers become more visible because the skin itself becomes thinner, and the effect can be very aging. So what you can do is I can actually sort of smooth out those bands and relax the muscles with a little bit of Botox. I literally pinch the band between my fingers, and then I apply tiny drops of Botox down each one of those bands, and then it relaxes for about 3 to 4 months.
That's a real result there.
Yeah.
So for about 4 months, and all of these options are non-surgical.
All non-invasive or minimally invasive, so minimal downtime. This would take me 5 minutes in the office.
All right, that sounds good.
Yeah.
Dr. Bowe, thanks so much for joining us.
Thank you.
Lara, over to you.
Thank you so much, both of you.